Richter's transformation remains an unmet medical need in the field of chronic lymphocytic leukemia. While it's fairly rare, it's very difficult to treat, and unfortunately, many patients die of Richter's transformation. So this is certainly not a diagnosis one would like to receive. And there are really no therapies approved specifically for Richter transformation or RT. So that was the goal of ERIC assembly, to harmonize some of the guidelines how to approach Richter transformation across the world. So Richter transformation typically presents with significant symptoms such as rapidly progressive lymphadenopathy, B symptoms, elevated LDH. So it is important to suspect RT when patients present with a multitude of debilitating symptoms. It is also important to diagnose Richter transformation on a biopsy. So when you suspect Richter transformation, a biopsy is essentially paramount. PET-CT aids locating the biopsy site which is likely to give the highest yield, because false negative biopsies are unfortunately a problem. So one would want to biopsy a lesion with the highest SUV. Then, as there are no good therapies for patients with RT, most patients should participate in a clinical trial if possible. And staging of Richter transformation, there is a big discussion on that as well, how to stage it on a clinical trial. And the consensus shows that Lugano criteria would be preferred, PET-based Lugano criteria, to accurately assess efficacy of therapies on the course of Richter transformation, given presence of underlying CLL. Another small point to make, which is sometimes difficult to execute, is it is very important to test for clonal relatedness between RT and CLL. There is about maybe 15 or 20% of patients who actually have clonally unrelated diffuse large B-cell lymphoma. So it is not a true Richter's transformation in that sense. These patients tend to do better with standard chemoimmunotherapy regimens, and it is really important to identify these patients. Meanwhile, patients with clonally related CLL-RT should be treated with novel therapies, including bispecific antibodies, CAR T cells, again, preferably on a clinical trial.